Phenytoin or diphenylhydantoin. Phenytoin is an anti-epileptic drug. It belongs to the class hydantoin. Phenytoin is diphenylhydantoin. It is one of the most commonly used anti-epileptic drug. It has a selective anti-epileptic effect and does not produce significant drowsiness. This is the advantage, that it does not produce significant drowsiness. Phenytoin is a selectively it has a selective anti-epileptic effect and does not produce significant drowsiness. Phenytoin does not produce significant drowsiness. Mechanism of action: it acts by stabilizing the neuronal membrane and prevents spread of seizure discharges. It acts by stabilizing the neuronal membrane and prevents spread of the seizure discharge. Phenytoin acts by stabilizing the neuronal membrane and prevents the spread of seizure discharge. The sodium channel exists in three forms: resting, activated, and inactivated. Phenytoin delays recovery of Na plus channels from the inactivated state, thereby reduces neuronal excitability and inhibits high frequency firing. So, phenytoin mechanism of action is it delays recovery of the Na plus channel from the inactivated state and thus reduces neuronal excitability and inhibits the high frequency firing. It acts by stabilizing the neuronal membrane and prevents the spread of the seizure discharge. Okay, it stabilizes the neuronal membrane. It will prevent the spread of the seizure discharge. It reduces neuronal excitability and inhibits the high frequency firing. It reduces neuronal excitability and inhibits the high frequency firing. Okay, so mechanism of action: it delays the recovery of Na plus from the inactivated state, reduces neuronal excitability, inhibits high frequency firing, and stabilizes the neuronal membrane and prevents the spread of the seizure discharge. At high concentration, phenytoin inhibits calcium influx into the neuron, reduces glutamate level, and increases responses to GABA. हाई कंसंट्रेशन पे कैल्शियम इन्फ्लक्स को इनहिबिट करता है इन द न्यूरॉन. At high concentration, it inhibits calcium influx into the neuron. It reduces glutamate levels and increases the response to GABA. हाई कंसनट्रेशन पे कैल्शियम इन्फ्लक्स को इनहिबिट करता है, ठीक है, ग्लूटामेट के रिलीज को इनहिबिट करेगा, रिड्यूस करेगा और गाबा के रिस्पॉन्स को इंक्रीज करेगा. फार्माकोकाइनेटिक्स: it is absorbed slowly through the GI tract. It is absorbed slowly through the GI tract, widely distributed, highly bound to plasma protein, almost completely metabolized in liver by hydroxylation and glucuronide conjugation. Repeated administration of phenytoin causes enzyme induction and increases the rate of metabolism of the co-administered drug. It exhibits dose-dependent elimination. Low concentration पे the elimination is by first order kinetics and plasma half-life is 10 to 24 hours. And as the rate of administration increases, metabolizing enzymes get saturated. Kinetics changes to zero order and plasma half-life increases to 60 hours. Low concentration पे first order kinetics, plasma half-life 10 to 24 hours. Higher dose पे zero order kinetics, half-life 60 hours. The plasma concentration increases markedly with slight increase in the dose, resulting in toxicity. Hence, therapeutic monitoring of phenytoin is essential for dosage. Uses of phenytoin: it is used in the treatment of generalized tonic-clonic seizure or grand mal epilepsy, partial seizures, trigeminal neuralgias, and status epilepticus. Phenytoin is administered intravenously in normal saline. Okay, it is administered intravenously in normal saline. It is not administered in glucose solution because it will get precipitated. Uses generalized tonic-clonic seizures, partial seizures, trigeminal and other neuralgias, and status epilepticus may. It is administered intravenously in normal saline. Adverse effect: phenytoin has dose dependent toxicity. The adverse effects are: note the H in the adverse effect, hypertrophy and hyperplasia of gum due to defect in collagen catabolism seen on chronic therapy, and can be minimized by proper oral hygiene. So, people taking phenytoin should have a proper oral hygiene. Okay, because this can minimize hypertrophy and hyperplasia of gums if they have proper oral hygiene. And this hypertrophy and hyperplasia of gum is due to defect in collagen catabolism. Hypersensitivity reactions like skin rashes, neutropenia, and hepatic necrosis. Skin rashes, neutropenia, and hepatic necrosis. Hirsutism. Hirsutism is due to increased androgen secretion. Hyperglycemia is due to decreased insulin release. Hirsutism due to increased androgen. Hyperglycemia due to decreased insulin release. Megaloblastic anemia due to folate deficiency. Osteomalacia due to increased metabolism of vitamin D. Hyperglycemia is due to decreased insulin release. Hirsutism is due to increased androgen secretion. Megaloblastic anemia is due to decrease in folate. Osteomalacia is due to increased metabolism of vitamin D. Hypocalcemia due to decreased absorption of calcium from gut. Fetal hydantoin syndrome, ठीक है, इसमें क्लेफ्ट लिप, क्लेफ्ट पैलेट, डिजिटल हाइपोप्लेशिया होगा ड्यू टू यूज ऑफ फेनिटॉइन ड्यूरिंग प्रेगनेंसी. So adverse effect: hypertrophy, hyperplasia of gums, hepatic necrosis, hypersensitivity reactions like skin rashes, neutropenia, hepatic necrosis. Hirsutism due to increased androgen. Hyperglycemia, hypocalcemia. One anemia, which anemia? Megaloblastic anemia, osteomalacia, and then fetal hydantoin syndrome. 8H, hypertrophy and hyperplasia of gum, hypersensitivity reaction, hepatic necrosis, hyperglycemia, hypocalcemia. Hirsutism. That's why it is not given in young women because of the adverse effect of hirsutism. Then female fetal hydantoin syndrome, which is characterized by digital hypoplasia. At high concentration, phenytoin may cause the following side effects: CNS, vestibulocerebellar syndrome. Vestibulocerebellar syndrome like vertigo, ataxia, tremor, headache, nystagmus, psychological disturbances on chronic use. Serious hypotension and cardiac arrhythmias may occur on IV administration. Extravasation of drug can cause local tissue necrosis. Nausea, vomiting, dyspepsia. It may be minimized by given phenytoin after food. So high concentration पे it causes vestibulocerebellar syndrome, hypotension, cardiac arrhythmias. Extravasation can cause local tissue necrosis, nausea, vomiting, and dyspepsia. But these can be minimized after giving phenytoin after, if we administer phenytoin after food.